people online. I'd like to present my co-host, Amy O'Brien, who's here to recognize the excellence with us today.
Hi, everyone. Hi, RD.
Thanks, Amy. Thanks for joining us. So we have hundreds of people online today that have registered today for the Health Value Awards and the exciting announcements that we're going to be making. And I want to just take a step back and talk about how this all came together and why it's just such an incredible movement in the healthcare industry and something everybody can join in to make a big difference in healthcare. And, you know, here we're presenting virtually, where we were intending to be down in Washington, D.C., presenting at the World Healthcare Congress, but these are different times. But the important thing is that we're being innovative here, and people really appreciate that innovation on examples like this of still carrying on, but more importantly, recognizing the innovation that's happening in the healthcare industry, which is extremely visible and vital today. So let me just give you a little bit of background on the Validation Institute and how the Health Value Awards came about. And then we're going to bring in an exciting keynote speaker at the beginning to kind of lay the framework for this incredible change that's happening in the industry. And then we're going to get to the awards and announce some incredible companies doing amazing things in healthcare and recognize them for that excellence. I'd like to also encourage everyone to join in the conversation, comment, chat, tweet. We're giving you all the tools to do that. Hashtag Health Value Awards if you can. You'll be seeing us on LinkedIn and all social media outlets as well. And before anyone asks, you will receive a full recording of this event once it processes, including all the slides and winners. And shortly after this event is over at 3 o'clock, we will be issuing a press release announcing all the winners. And speaking of the winners, everyone that was a finalist in this program is a winner. It was excruciating amount of very thoughtful review of all the candidates for the Health Value Awards. They're doing incredible things, and our judges spent hundreds of hours reviewing that. And I'd like to thank them for that. So everyone that's involved in this program is a winner. I'd also like to thank my staff, of course, Amy, who helped pull this all together, thinking she was going to do a live event, and now we're in a totally different world. I'd like to thank Steph and Chris and Karen and Paul and Brian and Fred and Linda behind the validations and Joy, who's helping her, and Benny, the CEO of the World Healthcare Congress, and Vidar Jorgensen, who's supporting all this great innovation that's happening here. So thank you. So the Validation Institute, what are we all about? Just in case you don't know, our roots come from Intel and GE, actually. They were coming out with a healthcare point solution, and like every other vendor, they were making a marketing claim. But their competitors were making marketing claims that were mathematically didn't add up, and they knew there was a problem. There was no underwriter's laboratory. There was no good housekeeping seal of approval in the healthcare industry. And for employers and the advisors advising employers, there really was no way to understand the hype through the truth. But the truth is, math doesn't lie, and behind every intervention and every marketing claim, there is data. And so it's a very simple concept. They got third-party funding to create the Validation Institute, which would be an organization with no horse in the race. It would simply exist to help the buyers of healthcare, a $1.7 trillion spend of all purchasing outside of government, to help them understand the hype through the truth. And that's what we do. So the Validation Institute got great traction through those years, and it was acquired by the same individual who owns World Healthcare Congress, Vidar Jorgensen. He saw a vision here, just like Warren Buffett sees, that healthcare, it is the tapeworm in the American economy. But the stimulus, the hope in the American economy is innovation. Events like working around hurdles and doing events like today and seeing the innovation of the vendors that we're about to bring you, and think of all the innovation that's happening in the American economy over the past 2 weeks to try to solve a problem. That's only going to accelerate, and we need to move forward and recognize those individuals. That's why we thought it was important to continue on today. So that was the premise of the Validation Institute. But what we saw as we talked to the buyers of healthcare, the employers, we found that they were getting their exact same, all their education. You don't go to college to learn how to buy healthcare benefits, one of the most expensive expenses in the company. You learn it from the same exact establishments that happen to make more money when rates go up. And that's just not right. So we went to work last January with the help of Brian Klepper and his network, and we put together the Certified Health Value Professional Program, the CHVP. And by May, we launched. And by June, we were recognized by SHRM, the Society for Human Resource Management. And all the HR professionals and employers that are on the call today will recognize that. And they fast-tracked us and counted our education because they saw a hole in this information that wasn't there. They saw our information filling that hole, and they counted it towards SHRM recertification credit. Then we started to accelerate getting noticed by the various business groups on health and the coalitions and the different organizations around the country that come together to try to make a difference in healthcare. And the Certified Health Value Professional Program is really taking off. It's an amazing program. It's all online. And I know there's a lot of people at home right now. This is a fantastic time to brush up on all those areas that can make a real difference in healthcare. So check out our website, validationinstitute.com. Send me an email, rd.whitney@validationinstitute.com, and we'll get you all set up. So we validate the organizations that are solutions to the industry. We educate the buyers of healthcare, the employers and the advisors trying to reach them. And then we connect them through programs like this, where we recognize innovation, and also online. And in the not too distant future, again, we will get together and have events. So that is the history of the Validation Institute. We hope you can join in with our mission, and we're very excited about the traction that's happening, and it's thanks to everybody. So now we want to move to the next phase of our program, which is to introduce our keynote speaker for this afternoon, who's going to give an overview of innovation that's happening in American healthcare and his view on that. I would like to next introduce our keynote speaker. Lee Lewis is the Chief Strategy Officer and GM for Medical Solution for the Health Transformation Alliance, HTA. If those of you that are not familiar, this represents some of the largest, most prestigious employers in America, representing millions and millions and millions of lives. So we're really excited to have Lee join us today. We're all calling in from remote and home-based offices. So Lee, thank you very much for joining us today. We look forward to your presentation.
Absolutely, my pleasure. Thanks, RD. On April 17th, 1775, there was a problem in Upper New England. Some of the colonists who were living in that area expressed concern because they had started to hear that the British troops who were around in their city were starting to comment on how on the following day the colonists were going to get it. And a few young boys heard this story or heard that this was occurring, and they ran across town to a local silversmith who was admired in the community. And they went in towards the end of the day and they related this story to him, that they'd heard that these British soldiers were saying this. And he nodded his head and listened, and he packed up his shop and he got on his horse, and not knowing necessarily what else to do, he got on it and started to ride out into the evening and later into the night with just a torch and one message, shouting out on every street in every hamlet, "The redcoats are coming, the redcoats are coming." And that one evening spurred preparations all through the night, so that on the following morning, when sure enough a battalion of British soldiers marched through that area, the colonists were prepped and ready, and they resisted with the battle that plunged us into the Revolutionary War. I love this story because the seeds of that change, of that revolution that had such enduring consequences, began with a regular guy who had a regular job in a small rural town and heard something and decided to take a very basic action. When we are in a crisis, whether it be a longitudinal one or an abrupt one, it creates opportunities for regular people, moms and dads, employees with regular jobs to step forward and take actions that have very long-standing influence and consequences on those around us. I love the story of Paul Revere because he was one such individual, one such regular citizen, and did something that had such an enduring end. And today, as we think about these individuals who have stepped forward and are winning the awards and being recognized today, these are, in many cases, incredibly remarkable heroes who are working to make things better in our country. As RD mentioned, obviously healthcare is such a phenomenal problem. And even right now, and speaking of the idea of crisis, we are in a crisis, but it's within a crisis. That healthcare in general, with decades now of continual cost increases, is ultimately hurting our society. And right now we happen to be inside a crisis within the crisis. But a few months from now, as the peak has been reached and we're starting to work our way out of the strangeness in which we find ourselves today, we're going to find an opportunity for us to continue making transformative influence on American healthcare. And even right now, as we're serving members and patients from the employer standpoint or from the vendor standpoint, we're having the opportunity to make changes and make a difference in healthcare. 3 quick stories that I wanted to share on this. The first one illustrates putting people above a general process. I have a friend of mine who has been recognized by the Validation Institute, who a few years ago was working at a major pharmaceutical company. And while he was working there, he was working within strategy and development. He figured out a new patent on a way to handle the drugs and distribute and prescribe drugs that would eliminate a significant amount of waste and error. As he and his team put together a proposal to bring that to the leadership, they eventually succeeded in having that time, and they made a remarkable presentation to the CFO that explained all the ways that they would be able to save money and change the system, making it better for everyone. At the end of the presentation, they sat down expecting to hear really positive remarks. And with the door closed, the CFO leaned forward and said, "You understand why this can't leave this room, right?" That when they had proposed this process that was changing the system and the way that things were being done within this organization, because it was a threat to the business model, no matter how many dollars it could save or how many people it could help, it had to stay within that room. And my friend had the opportunity of either staying there and living with that and bearing that idea, or leaving, both of which would be scary and challenging. And ultimately, he decided to leave, and that was the impetus to go in and to found a company that to this day is now creating remarkable success within the area of pharmaceuticals. I love that story in terms of illustrating that sometimes in making the right decisions, they're not easy, and they do require us to put people and patients ahead of whatever the process in the business model is. And that over time, history has always shown that if we try to defend a business model rather than defending the needs of the customer, it ultimately will cause a failure as the customer moves on to those who listen. The second story that I wanted to share is about another friend of mine who I have the opportunity to work with within the HTA. She was working with her major carrier, but was really frustrated. Where in her state, there was a lot of problems and very high variability around the cost and quality of care. And in desiring and attempting to move her members to better care, she went to the carrier with whom they had a decade plus long relationship and requested that they allow her to be able to steer and to move her members in the way that she needed to, and to create the plan incentives and logical common sense benefit tiers and strategies that would help for people to get to good quality. And alas, they came back and said, no, like that's not going to be the case. And this company, this vendor, had worked with them for a long time, had incredible relationships all up and down of command. And she had a decision to make. Was she going to potentially create significant issues for them with, for her within the company, political issues and everything else, plus doing a mountain of work, taking a step into the unknown to try and bring this strategy to fruition, or just to settle and stay within what they had? And 9 out of 10 people are just probably going to opt for the latter and try to just make the best they can with what they have. But she didn't. She went forward. She fired that carrier. She went through all the internal hassles that went along with that. And she took a bold step into the unknown as a massive Fortune 100 company, hiring a TPA that they had never heard of 90 days prior, and went to the carriers in her area and said, hey, who will work with us with this TPA? None of the carriers in that particular area had worked with this TPA before, and with their full and replete network. And shockingly, she was able to have one of them step forward and change a 50-year business stance of not working with an independent TPA. They changed that and began working with the TPA. It's the first company they had ever done that with. And that to me shows the power and the value of acting with courage and taking a step into the unknown. The last story that I'll share is about a hero of mine who really explored how to keep things in perspective. He used to run all the procurement for beverages. This is for he works inside a gas station convenience store chain. And he was the head of purchasing over beverages. And the story tells that he had these incredible perks that would come from that, whether it be golfing trips or fancy dinners, that the buyers representatives from the beverage industry were really great to work with. And that was an incredible position for him to be the chief buyer over that segment. But one day he had the chance to get a promotion, and they moved him to the highest cost vendor segment that existed within the organization, which was managing their healthcare. And so he came into the role really excited. It was a promotion. It was more money than what was being managed on the other side, and began to ask, when is it that we go out to dinner or do the golf trips or whatever with all these hospital vendors, right? Because they've got so much of our money and influence. And he was a bit dismayed to learn, no, it doesn't work like that. Nobody's met with any of the hospitals or the leaders or the vendors that are here. It doesn't work like that with the medical system. And a bit crestfallen, he said, well, I can't be the head of purchasing if I haven't met my supplier. So he made appointments to go and visit with the leaders of the local hospitals, and went over to one of them, walking in blue jeans and a faded black polo with the gas station logo on it. He went into the giant glass citadel of this hospital there in the town where their headquarters was located. And he went to the top floor with a giant boardroom filled with these men in suits. And he's a young guy in his 30s, and he sits down and starts talking about how he wants to have a direct relationship with the supplier. And they say to him, no, it doesn't work like that, right? Like you still work through all the other entities. And he said, no, I want to have a relationship direct. I want to be able to buy my services from a supplier who I can understand. And they were sort of dismissing him a little bit. And then he did something remarkable. He held up his wallet there in the room and said, you have forgotten who holds the wallet. He said, we treat customers who come into our gas stations to buy a 79-cent drink better than you treat our members who are coming to your hospital, where we spend $7 million a year. And that changes today. We will have a direct relationship with our suppliers, and we are going to do what's right for our members from a practical standpoint. And he left that day and did not end up having a direct relationship with that hospital, but he was able to move the traffic and move the business and move his business to a hospital that was willing to do it. And he ended up having significant change within that city and had taken that model now to over a half dozen other major cities where they operate. And to me, such a, that's a heroic stance in terms of reaching out and changing the model and not accepting something that doesn't make sense just because it's the way things have been done. My hope is that, today we can extend full congratulations to the employers, to the advisors, to the vendors, and others who are taking a bold stance to try and transform and improve healthcare within this country. And I celebrate everyone who was both nominated and also the winners today. And am grateful for what you're doing and how you're stepping forward to help make significant change and improvement for our country. Thank you.
Well, thank you so much, Lee. I really appreciate everything you've done for the Health Value Award and the Validation Institute. You act with such selflessness and inspiration for all of us. So thank you very much, and we appreciate it. Speaking of other people, I want to thank. We had many judges that helped pour hours and hours over the awards. So I would like to thank all of them. If you had come live at Washington as we had planned, you would have had one of these pretty impressive books in your hands that describe all the winners that will be announced today and the finalists that were nominated. And just to become a finalist, it went through a pretty intensive process through the judges. So we will be sending this to you electronically. You'll be receiving a flip book, and if you are a finalist, you will also receive a physical book. And just to show how the Health Value Awards has grown over the years, we're in the third year of the program right now, and this was just the first year. So it has grown tremendously, and the excitement has grown tremendously, and it's really been great for everyone that's been involved. While Lee was talking, I got a little coaching, just a quick text saying I used the word incredible so many times that I should probably apply for the Trump administration. So I'm going to not use that word, but I can't help it. There's great innovation that's going to be announced today. Maybe I'll just switch the word to tremendous, and we'll go on there. But it's one thing before we're going to go into our non-peer reviewed awards first. And before we do, I just want to announce that we are going to be starting something called Webinar Wednesdays, where we will have spotlights on the finalists and winners that have been involved in the Health Value Awards program. So if you are one of those organizers, and we'll certainly reach out to you, we're going to be making presentations online every Wednesday to help bring the great message out to the employers that are out there. Because we're in this now, but we want to get employers to go through the CHVP education online so they're ready, and advisors that advise the employers. We want to be ready for health benefit seasons, which is going to be upon us before we know it. So with that, let's move on to the tremendous award winners. First, we'll have our non-peer review awards. Okay, let's go to the first category. Our first category is healthcare purchasing collaboration. And of the finalists, the winner is the Healthcare Transformation Consortium. Congratulations.
Our next category is HRIS technology vendor. And the winner in this category is MedLiminal. Congratulations.
Our next group category is for large group for the non-peer review awards. And I forgot to show everyone the actual award that our winners will be winning. We'll be sending this out to all the award winners. And as well, we will be doing a press release following this virtual event. at 3 o'clock. So for the large group, the winner is for the Silver Award, City of Austin Wellness Program. Congratulations.
And
For
the gold winner,
award, yep, go ahead,
sorry,
Amy.
the gold winner is the Metro Nashville Public Schools.
Schools, great, congratulations. Okay, our next non-peer review award category is marketing company. And from all the finalists, the winner is Spire for their HR Journey Builder Periscope program. Congratulations.
Our next category is mid-sized group, and the winners are, it's a tie, Carmel Clay Schools and Ameribend IEC Group. Congratulations to both.
Great. Our next category for the non-peer review awards is to recognize innovation that we call our spotlight category. And the winners are in this category: Health E-commerce, Scripta Insights, U-Turn, and Allegis Smart Account. Congratulations.
And our winner in this category is, for gold, it's the Connecticut Joint Replacement Institute. Congratulations.
Okay, great. Now we have a slide here just to remind you that we'd love to hear from you while we're running this virtual event and award announcement. You can chat right into the platform here. You can leave a message on, you can tweet for Health Value, hashtag Health Value Awards. And then later you can as well, when we post on LinkedIn and other social media activities. But please ask questions and tweet, and we will get to them. If not during the awards program, we will certainly get to them after and help connect you in any way. And again, for all those that are on the program, you will receive a full recording of this, along with all the slide presentations, and you will receive the flip book for the Health Value Awards program guide. So now let's go to the next part of the program, the peer-reviewed awards. And again, we'll be sending all the winners the trophy here, which we will use, we will clean off here and do a quick disinfection before we send. Great. All right, now we're going to do our first category is alternative reimbursement vendor. And from all the entries and finalists, the winner Remedy Partners, Remedy Episode of Care Management Program. Congratulations.
Up next, behavioral health is our category, EAP, and our winner is Mind Sciences, Inc. for their program Unwinding Anxiety.
Next category, bundled surgery providers. The winner, silver winner is Texas Medical Management, Texas Free Market Surgery. Congratulations.
And the gold winner in this category is Midlands Orthopedics and Neurosurgery for their outpatient surgery program. Congratulations.
Our next category, care coordination. And from all the finalists, the winner, Apta Health. Congratulations.
Our next category is diabetes management, And from our finalists, our winners are, in the bronze category, it's Tria Health.
And in the silver, the next winner is Silver Abacus Health Solutions.
And finally, our gold winner in the diabetes management category is Virta Health. Congratulations to all.
As you can imagine, if we were in Washington, D.C. and a full audience at the World Healthcare Congress, there'd be lots of clapping going on. And so this is sort of running a sitcom with no audience. And I know that there's a lot of activity online, and we have hundreds of people on this program. And that is just the start. So we will have this program live, be recorded, it'll be sent out to you, but it will be viewed by tens of thousands of people by the time this is filtering through. And lots and lots of fabulous employers that are involved with Validation Institute. Okay, great. Our next category is fertility vendors. And the winner, ARC Fertility, the ARC Fertility Program. Congratulations.
Our next category is maternity management, and our winner is Wildflower Health for their maternity digital application.
The next category, mindfulness vendors. And the winner, eMindful for EM Life. Congratulations.
Moving on to musculoskeletal management, our winners are, for the bronze, Solve Global MSD Solutions.
And for the silver, UT Health Austin Musculoskeletal Institute.
And finally, our gold winner in this category is Virtual Physical Therapists.
Think of how impactful this is. Musculoskeletal, as we all know, is one of the biggest spends in healthcare. And we're bringing you companies that were finalists, and then companies as well that were picked by our judges. But they're all great organizations that you should definitely check out. And as you go through the CHVP program with the Validation Institute, you learn to apply some of the same criteria that our own data scientists apply in validation. And I would encourage you as well to go online to the Validation Institute and check out our community under validated programs. So you can read a brief synopsis of what the program was and how it was validated, what the intervention was and what we validated. So that's right at our website, validationinstitute.com. So next category is obesity-related solutions. And the winner? Blossom Bariatrics Fast Track Program. Congratulations.
Our next category is Pharmacy Benefits Management, and our winners are, for silver, MPRX Health, Congratulations.
And the gold? Trexie, congratulations. Another huge category for people to take a look at.
In the Population Health Management category, our winner is, for silver, Med Incentive for their program Mutual Accountability and Information Therapy Program.
And the gold winner, US Healthcare Center, Predictamed. Congratulations.
Our next category is primary care, and our winner is Proactive MD, their program is the Advanced Primary Care. Congratulations.
All right, our next category, specialty imaging. And as you think about all these different categories, just another resource that I want to let you know about on the Validation Institute website is if you check out what we do, and you'll see a link called The Exchange. We have over 1,700 programs and vendors listed there by 51 categories. Many of these are validated, way too few. We're getting more and more. And as the employers on the phone, you should insist that organizations have their programs validated and their marketing programs validated, their marketing claims validated, just to help you with that purchasing decision. But go to the validationinstitute.com, go down to what we do and click on Exchange and check out those 51 categories and the companies that are listed in there. But this next category, specialty imaging, the winner of the Health Value Award is Green Imaging. Congratulations.
Up next is telemedicine vendors, very timely. Our winner in this category is an honorable mention to Sequino Saffron.
And next, third-party administrators. It's the category. And the winner, Nova Healthcare Administrators, Health Plan Performance Management. Congratulations, you were selected by our judges.
In the transparency tool category, our winners are, for the bronze, Fresh Bennies.
And for the silver, MMS Analytics, My Medical Shopper. Congratulations to the team at My Medical Shopper.
And our gold winner in the transparency tool category is the Leapfrog Group for their Leapfrog Hospital Safety Grade program.
These are wonderful programs. Our next category is wellness vendor. And as you can see, we're going alphabetically, so we're getting towards the end. From the wellness vendor, from the finalists, the judges picked Blue Cross and Blue Shield of South Carolina, Population Health Management Programs. Congratulations. Okay, that's our peer-reviewed awards and non-peer-reviewed award winners. As I mentioned, we will be sending out a press release following this. I appreciate everyone staying on the webinar through the whole time. It looks like almost everybody is staying on through the whole time. That's great, because the next part of this, the final part of this award ceremony, is recognizing fantastic individuals that have done amazing things to benefit healthcare in the industry. And I'd like to introduce Dr. Brian Klepper to present the honorary awards for the Health Value Awards Program 2020.
Good afternoon. Thanks for joining us. The following honorary award winners were chosen. First, they were nominated by asking people in the industry to tell us who they thought should be considered, and then we discussed it internally with the entire team, the entire senior team of the Validation Institute, and then we submitted our recommendations to the judges. So there's been quite a bit of activity around choosing these particular individuals who we think are really making a difference in healthcare generally. The first one, I want to make sure that I'm here. Yes, Katie Archer. Katie Archer is Director of Health and Welfare Plans for Benefit Design, Planning, and Analysis at the Hartford in Hartford, Connecticut. After reviewing the Hartford's claims data, she created an exclusive provider organization option that eliminates cost barriers by removing the deductible, by charging flat dollar copays instead of coinsurance for common services, and for offering free medical telemedicine. Members are incentivized to use certain in-network providers, and non-emergency out-of-network care is not covered. Katie's an advocate for self-funded health plan sponsors who have to have access to their own claims data. She joined 7 like-minded employers in DC last October to encourage Congress to pass employer and patient healthcare data transparency legislation in 2020. For boots on the ground, value-focused health plan innovation, the Validation Institute recognizes Katie Archer as Outstanding 2020 Employer or Union Benefits Manager. Congratulations, Katie. Next, we should have Outstanding 2020 Corporate Senior Leader for Health Benefits. This goes this year to Lisa Woods, Walmart Senior Director of Benefits, who oversees that company's healthcare strategy. Walmart has tinkered with different primary care models for a decade or more. As with its Centers of Excellence program, the goals of Walmart's new healthcare programs are a more refined, disciplined, and methodical set of innovations in patient engagement and navigation, telehealth, and provider quality, focus on driving better care, a better patient experience, and lower cost, and that for the most part are not yet available to most primary care patients elsewhere in U.S. healthcare. Lisa is actively involved in positively influencing healthcare designs outside of Walmart as well, and is affiliated with the National Business Group on Health, the Pacific Business Group on Health, Catalyst for Payment Reform, and the Council for Employee Benefits. For her leadership in developing and driving practical, value-focused healthcare solutions, the Validation Institute recognizes Lisa Woods as Outstanding 2020 Corporate Senior Leader, Health Benefits. Congratulations, Lisa, it's a pleasure. Next, we have Outstanding 2020 Benefits Advisor or Broker. There we go. This goes this year to Jeffrey Hogan in Connecticut. Jeffrey Hogan is the Northeast Regional Manager for the Rogers Benefit Group, and with an extensive book of business throughout New England, he's been a leader in the healthcare value transformation for the past decade. He's worked on all fronts to advance the principles of the value agenda, healthcare consumerism, disruptive innovation aimed at all stakeholders, and data transparency and accountability. He is the newly appointed regional leader for the Leapfrog Group in Connecticut. He's on the executive committee of the Moving to Value Alliance, and he serves on the advisory panel for the Validation Institute. Jeff has helped to influence statewide projects promoting the use of alternative payment mechanisms and centers of excellence. He has lectured nationally on the urgent need to upend the status quo in healthcare and its entrenched incumbents. For his pragmatic contributions to deepening health values traction in the marketplace, the Validation Institute recognizes Jeff as Outstanding 2020 Benefits Advisor or Broker. Congratulations, Jeff. Next, we have Honorary 2020 Lifetime Achievement for Health Benefits Innovation. This goes this year to a recognizable name, Dave Chase, one of the key healthcare reformers of the past 5 years. Dave Chase leveraged his experience as a serial entrepreneur and technology executive, defining a new set of principles that can guide a healthier healthcare enterprise and describing how to generalize those changes in the marketplace. He pointed particularly to successful innovators, organizations that had consistently demonstrated high performance, meaning better health outcomes and or lower costs, within high value niches as guideposts of an achievable superior healthcare system. He focused on healthcare advisors as a critical node for change and recruited top reform-minded brokers around the country. For advancing the explanations of what ails healthcare and for helping the marketplace become more receptive to rational solutions, the Validation Institute recognizes Dave Chase with an honorary 2020 Lifetime Achievement Award for health benefits innovation. Congratulations, Dave. It's well deserved too. Next is honorary 2020 Lifetime Achievement for Clinical Care. There we go. Goes this year to Keith Smith. 10 years ago, Keith Smith, an anesthesiologist, co-founded Surgery Center of Oklahoma, one of the nation's first outpatient surgery centers to voluntarily publish and post online an all-inclusive bundled pricing for all procedures. The center was founded on simple market principles, high quality care, and transparent fair pricing, which made it a rare offering at the time. Total package surgical pricing includes fees for the surgeon, the anesthesiologist, and the facility. Since the center is owned by physicians and does not accept government health programs, they are able to eliminate many administrative costs and pass the savings on to their patients. Often, the center charges a fraction of the cost of what local hospitals charge for routine procedures and has lower rates of infection than their competitors. The center's transparent and affordable value has made it a national center of excellence for outpatient surgery, benefiting patients and organizations that sponsor their health coverage. It also helps people who never end up setting foot there. Other outpatient centers have followed the center's initiatives and have posted all-inclusive transparent prices. And patients needing outpatient surgeries use the center's online pricing to negotiate better rates at their local hospitals. For its exemplary work in driving transparent, affordable value, Validation Institute recognizes Keith Smith, MD, and its Lifetime Achievement Award for Clinical Care. Congratulations, Keith. Next is a posthumous honorary award for the Hall of Fame. It goes this year to Clayton Christensen, a name that many of us know. Clayton was a Harvard Business School professor renowned for his writings on the dynamics of innovation. He passed away in mid-January. His work was absorbed and celebrated by icons of business and academia, and his two books on healthcare, The Innovator's Dilemma and The Innovator's Prescription, have become essential guides to viable healthcare change. If anyone has had a positive influence on the healthcare industry and laid the groundwork for what would become value-focused healthcare, it was Dr. Christensen. Humble, unassuming, and wise, Dr. Christensen assumed that his professional management principles applied to our personal lives as well. One essay called "How Will You Measure Your Life" took many of his management concepts and applied them to evaluating how one lives. In it, he offered this advice: don't worry about the level of individual prominence you have achieved. Worry about the individuals you have helped become better people. Think about the metric by which your life will be judged, and make a resolution to live every day so that in the end, your life will be judged to success. For lighting this path, the Validation Institute recognizes Clayton Christensen with an honorary 2020 Hall of Fame award. It's a nice thing at the end of your life. Finally, our honorary 2020 Hall of Fame winner, Dr. Marty McCary. In the past year, Dr. McCary has been healthcare's most visible and credible representative of meaningful clinical and economic reforms. In his surgical specialty, islet transplantation, he was recognized by the National Pancreas Foundation in 2015 for, quote, outstanding achievements in the areas of pancreatic research and treatment. He is also the inventor of the Johns Hopkins checklist, the surgical checklist made popular by Atul Gawande. His professional life has been made into a hit TV show, The Resident, which has been renewed for a third season. While plenty of people have eloquently criticized healthcare, few have brought an insider's credibility. His work in this area is not just academic. Marty has taken unpaid time out of his schedule to investigate systemic abuses. His two books, Unaccountable and The Price We Pay, have profoundly influenced health policy. The latter highlighted many provider abuses, has already led to resignations, apologies, and even proposed legislation. A particular focus has been surprise medical bills, creating a workaround so that despite an absence of congressional action, no one ever again needs to fear that surprise bills in emergency settings could drive them into bankruptcy. For inspiring servant leadership in the drive toward a better health system, the Validation Institute is delighted to recognize Dr. Marty McCary with its 2020 Hall of Fame Award. Congratulations, Marty. Great going. Those are our honorary awards for this year. Thank you very much. Oh, and also a big thank you to our judges. Our judges put in considerable time. They're a wonderful group of very experienced healthcare professionals, both clinical and administrative. They're a superior group, a really excellent group, and they take on a very difficult task, very challenging, often subjective, and they perform at a very high degree of quality. We can't thank them enough.
Thank you so much, Brian. And I would like to remind everybody let me share my webcam here. I'd like to remind everybody when you receive the Health Value Awards book link, you will see write-ups for all the honoraries that Brian just mentioned in the book. You will also find write-ups for our judges in the book, and lots of other details like the fact that the World Healthcare Congress 2021 date is currently April 1 through 4, and that's when we will be doing the 2021 Health Value Awards. Before we go off the honorary awards, I'd like to congratulate Lisa and Katie and Jeff and Dave and Keith and Clayton and Marty. Just amazing people to be recognized. And I'd like to thank Brian Klepper for all the work that he and Fred Goldstein and others did, and Vidar Jorgensen along the lines to help bring these awards today and make them so visible. A couple just other details before we close up. As I mentioned, you'll receive a recording of this award announcements today. We'll get that to you by this evening. You will also see a press release going out announcing all the winners. A previous press release had gone out to announce all the fabulous finalists that were picked by the judges. But so much goes into this. Hundreds and hundreds of applications boiled down to a group of finalists, then boiled down to announcement of winners for that year. But it is just that year. This will go and grow on, and it will happen in person in Washington, D.C. in April 2021. And we encourage you now to start thinking about companies to nominate, because we want to surface the great things being done by companies to help the employers that are going through our education and coming to the Validation Institute for guidance. I'd like to thank my co-host, Amy O'Brien, helping to announce the winners today and helping to put on this program and bring it to you, which is so important to continue on without disruption, recognizing the innovation. If you have any questions at all, please send me an email, rd.whitney@validationinstitute.com. That's rd.whitney@validationinstitute.com. You'll receive an email from me with the links I discussed. And please help us continue to make the Validation Institute more visible and more helpful to the employers trying to make great healthcare purchasing decisions for their employees. Keep up the great work, everyone, and let's continue to improve healthcare. Have a great day.
Congratulations, everyone.
Congratulations.